For this lab, we will work on the calf specimen, on the thoracic limb still. So we'll finish the thoracic limb and then move into the distal part of the thoracic limb and the foot also. On the medial side of the forelimb here, you can see there's some skin that we still need to remove. So you're just going to make a medial incision all the way down to the hoof, the coronet, the transition between hoof and skin here, and actually just take that off. So you'll remove that skin and you can discard it. And you can see here that I've reflected and removed my dew claws here. So you actually want to remove those as you take the skin off. Just take the dew claws with it and then remove that whole piece. So here on the medial side, we'll take a look at some of these muscles and finish out the thoracic limb. So right here, if you recall, we have the flexor carpi radialis muscle here. So you want to orient yourself by starting with that muscle. And then we're going to look at the digital flexor muscles. So that's this group here. So we've already kind of opened up this carpal canal area here and looked at some of these vessels and nerves. But you want to pull those kind of out of the way, and we're going to follow the tendons of the digital flexors here. So first of all, you'll have a superficial digital flexor. So that's actually the most superficial part here. And in the bovine, it tends to have two very distinct parts to the superficial digital flexor, and then the tendons kind of come together down here. So you'll have these two bellies to that muscle. So these are both superficial digital flexor. And you can kind of pull them out of the carpal canal and then follow the tendons up and pull the muscle bellies out to see them. And so both these tendons are superficial digital flexors. So then, once you have done that part, you kind of pull those out of the way. And here I'm pulling out the deep digital flexor muscle. So here's deep digital flexor muscle, and that will have several heads. So if you pull out the superficials, you can see there's more muscle bellies in there. But you don't have to differentiate the separate heads. You can just find the deep digital flexor muscle and trace the tendon distally down towards the foot and pull that out as well. So all of these will kind of be compressed together into looking like one big tendon, but you can separate the parts. So here you've got those two superficials. Here's the one big deep digital flexor tendon. So one big difference you have in the calf versus the pony is that there's no check ligaments in the calf. There is one small check-like structure that you might see between the superficial digital flexor and the deep digital flexor. You may see that structure, but it's not significant for our purposes. All right, so after you have dissected those, you can trace the tendons down toward the foot. Just be careful of your nerves and vessels here. So your nerves and vessels in the calf are slightly different than in the pony because you actually have two digits instead of one that they'll be going to. And so these are actually just called median all the way down. They do not change names to medial palmar as in the pony. So in the calf you have median nerve and median artery, both continuing down through the carpal canal. And then you'll have some branching happening down here, but you don't need to necessarily dissect those out here in the calf because there's a lot of branching going on. Just know that the similarities are there between the calf and the pony, but they are doubled basically for each toe. So you have, instead of one digit, you have two digits. So you have arteries and nerves going to each. All right, so now we'll take a little more of a cranial and lateral view and finish up the thoracic limb. So here we're looking at more of a cranial and lateral view. So here would be cranial, and here we're on the lateral side over here. So on the calf, the muscles are similar again to the pony. However, you have to keep in mind that you do have the two digits down here. So you're actually going to have more tendons than you do in the pony. So I'll explain that in just a moment here. So to orient yourself, you want to again identify, which we've already done, the extensor carpi radialis muscle here, going over the cranial aspect. And then you'll kind of move around to the lateral side, and we're going to identify the lateral digital extensor here, going down and across the carpus, and then extending down toward the lateral digit here. So that's lateral digital extensor. And here you want to note that the lateral digital extensor actually passes underneath this lateral collateral ligament of the carpus. So those can be difficult to see in the calf, especially because of all this very thick fascia you have. So if you can see that, at least see the tendon going underneath it. It may be difficult to see, but you can at least see that part of it there. So that's the lateral collateral ligament of the carpus. The medial collateral ligament on the other side is not as distinct, and it's typically pretty difficult to see on the calf. So moving on, we have this that was a lateral digital extensor. Then we're just moving in between that extensor carpi radialis and your lateral digital extensor. And here you have the common digital extensor. So in some texts it will say that these are two separate muscles, but for our purposes we're calling both of these muscle bellies, there are two of them. Here you can see the separation. There's two muscle bellies there, but we're going to call them both common digital extensor, and it has a medial head on the medial side and a lateral head towards the lateral side. So both of those being called common digital extensor. So you want to isolate those and then follow the tendons down underneath this extensor retinaculum. If you need to cut through that, you can. And then just continue following the tendons down toward the digits. And as you follow them down, you definitely see that there are two of them, and they split apart and go to the two different digits. So here you have this one is going more towards the medial side, the medial digit, and then this one is splitting and going to both of them. So that's the common digital extensor there. All right, so now we're going to take a look at some of the structures in the distal part of the foot here, and it'll be more of a caudal view. So this is a caudal view of the distal part of the forelimb on the calf. Here I've cut through both of my flexors here. So the superficial digital flexor and the deep digital flexor have just been transected straight across. And I'm actually just going to pull them out from underneath these vessels and nerves so I don't end up cutting those. And so you can dissect distally down into the foot here. And so you're looking at this part where you have all these ligaments that are holding the tendons in place. So here I've cut one side of them so that I can show you a little easier as I pull the tendons out. So here, going across the palmar aspect is the palmar annular ligament, and so it goes across and kind of inserts in between the digits here also, but it's one continuous ligament across. So you have palmar annular ligament, and here I can lift it up because I've cut it, and you can just keep reflecting your flexor tendons so that you can see those. Then the next ones are the digital annular ligaments. So here in the calf, they kind of look like they're one big digital annular ligament on each toe, so on each digit you have them. But you can differentiate them into a proximal and a distal if you really want to. But as long as you see that they have digital annular ligaments, that's fine. So you can continue reflecting, cut through those, and elevate those flexor tendons. Here you see that area of the flexor manica where your two flexor tendons are switching spots. So here you have the superficial branching around and deep coming through. And so that gets very thick. I don't know if you can see this, but when I had to cut these, there's a big thick edge here. So you can feel free to cut through that as you cut these tendons away and pull them down. Just so you don't think you're cutting through something that you're not supposed to, that's fine. You can cut through those as you pull those tendons down. All right, and then the final one down here that you need to see is unique to the calf. The horse does not have this one. So this is the distal interdigital ligament. So it spans across that space in between the two digits. So interdigital, and it's the distal because there's also a proximal that's hidden up in this space here that we don't dissect. So the distal interdigital ligament is right here. So you can see that proximal edge here. It's kind of hidden underneath by some of the foot here, but this is it right there. All right, and then the last thing we want to look at is the interosseous tendon or suspensory ligament, and it's similar to that of the horse in that it looks somewhat like a tendon rather than a muscle, but in the calf I think it actually looks a little bit more fleshy and more muscle-like. So this is it right here. Try and get the probe underneath to elevate it a little bit here so you can see it, and as it's extending down. The difference in the calf is that it actually splits again because of those two digits. So you can see it splitting here into separate parts, and so it's got these different parts going down to the toes. So hopefully you can see that there. And then we've also got the extensor branches that will then come around to the front side like we did in the horse also. And here I'll just put the probe underneath it and hopefully you can see part of that as it comes around to the cranial aspect. So this is the extensor branch of the suspensory ligament. And so that happens on each side, so one on this side and one on the lateral side also.